Welcome back. In this video we'll talk about basal cell carcinoma. This is the most common type of skin cancer and it tends to occur in the face and sometimes the neck. If it occurs in the face, it tends to favor the upper lips, unlike squamous cell carcinoma, which normally occurs in the lower lip. The lesion itself will be very pink or sometimes brownish, and sometimes it appears shiny or waxy, with surrounding telangiectasia and rolled up borders. The presence of crusting or ulceration, especially in the center, is a sign of progressive or long-standing basal cell carcinoma. The most common presentation is an ulcerated lesion that has not healed for a long time. Although the cancer itself is fairly malignant, it does not aggressively metastasize. It's a local disease and it favors invading the surrounding tissues rather than metastasizing distally. If we take a sample and put it under the microscope, we'll see palisading nuclei, which means that the nuclei will be aligned together. The treatment is excision, and if the carcinoma involved the face or was very large, we use the Mohs micrographic surgery, which is a technique that we use to take only the tumor out and no healthy tissue whatsoever. Normally, if we have a skin cancer anywhere, for example in the thigh, we'll take out the tumor and we'll take a safe skin margin or a healthy skin area of around 5 mm surrounding the tumor. This is to make sure that we take all the tumor cells, even the ones that we don't see. We don't have this luxury when it comes to the face, and so we use the Mohs micrographic surgery, where we take out the tumor and we take smaller and smaller parts of the skin surrounding the tumor and immediately look under the microscope if we see cells there or not. So instead of taking a large margin in the first place, we take smaller and smaller margins or skin samples until we don't see the cell carcinomas. It is very unlikely to reoccur with about 5% rate. And here's a small quiz. Which of the following patients is most likely to develop basal cell carcinoma? And the answer is the skin of a patient who is constantly exposed to the sun. Alright guys, that's all I have. Thank you so much for watching and hopefully this helps.